Welcome. I'm Dr. David Wargowski, the Principal Investigator of the Great Lakes FASD Regional Training Center. This is the sixth in a series of podcasts based on the FASD Competency-Based Curriculum Development Guide, developed by the Centers for Disease Control and Prevention. The goal of this series is to educate physicians and allied health providers about the prevention, identification, and treatment of FASDs. The sixth podcast will address treatment strategies. In Podcast 6, we'll review several comprehensive studies of behavioral and educational intervention strategies, and then also briefly review some recent and emerging evidence that may lead to possible dietary or medical interventions. It's important to understand that knowledge of the neurobehavioral effects of prenatal alcohol exposure and an accurate FASD diagnosis can substantially inform the design of service provision for individuals. At the same time, there's a great deal of variability between individuals, which demands an individualized approach to these design processes. Addressing the needs of individuals with fetal alcohol spectrum disorders involves looking at their environment, counseling and therapy methods, alternative interventions, and pharmacologic management. Environmental strategies include incorporating structure into the environment, predictability into the schedule, and monitoring the level of stimulation in the environment. Many individuals with FASDs have difficulty retaining information, so repetition of learning strategies is often necessary. Multi-modality instruction, which allows approaching information from a variety of different directions, is often also helpful. Structure includes an organized, safe physical environment, well-defined areas that are consistently present, reducing the number of people in the immediate environment, as well as clutter, and striking a balance between minimalism in the environment and some appropriate level of stimulation. Predictability among staff members, family members, and professionals. Assigned seating can be helpful. Consistency in routines at school and at work and at home and in the community is also helpful. When changes need to be made, some forewarning is often essential. Teaching about consequences and contingencies, if you do something, then the next thing will happen, can also be very informative. Monitoring the level of stimulation involves protecting from overstimulation, including supervising TV use, monitoring use of the internet and electronic games, as well as extraneous activities. Learning to anticipate danger signs, giving frequent short breaks, redirecting behaviors when they arise, and acknowledging anger and overstimulation when it occurs. Retention difficulties can be ameliorated by speaking in shorter sentences, teaching concepts individually, having the individual repeat the information that he or she has just heard, and teaching memory strategies for daily living. Concrete thinking is often characteristic of individuals with FASDs. Communication must take this into account. Many of the phrases and terms that we typically use in daily conversation are more abstract than we often appreciate. Several of these are listed in this slide. Making an effort to incorporate concrete language in instruction and interactions with individuals with FASDs often makes the message more clear. Several examples are given on this slide. Modifying timeframes can also be quite helpful, such as giving individuals with FASDs additional time to complete homework, chores, and other daily living activities. Increased time and forewarning prior to transitions and other changes in routine, and giving individuals increased time to process and respond to requests and requirements. Multi-modality instruction can take the form of pictures and other visual cues, uses of songs or rhythm, written lists and reminders, sign language to supplement verbal language, and using recorded messages, as well as role-playing and modeling behavior. And again, repetition is often very helpful and necessary. Many of these approaches can be useful even in the counseling and therapy setting. Decreasing stimulation in the environment to avoid distraction, using more individual rather than group counseling, planning sessions at a time of the day in which a child is more comfortable, moderating the length of sessions, and adjusting the number of sessions per week to the child's needs. Use of practical and concrete language is also helpful in the therapy setting. It's important to recognize that it might be difficult for the individual to translate information from one setting into another, so using examples with which they're familiar can be very helpful. Often it requires an assessment of the home and work and community environments. Other considerations in the counseling and therapy context include a revision of the 12-step facilitation process to use more concrete language. Motivational interviewing techniques also involve somewhat abstract thinking and may not quite be as effective in this population. A number of evidence-based interventions have been developed in recent years. One from UCLA called Project Bruin Buddies involves a technique known as children's friendship training. This involves social skills and behavioral instruction and modeling with role-playing and feedback. Parents also undergo training at the same time in order to help facilitate the information that their children are learning. It improves knowledge of appropriate social behavior and quality of life at home and at school. The Georgia Math Interactive Learning Experience at Emory University provides tutoring methods that improve math and knowledge and skills among individuals with FASDs. Behavioral regulation and executive function have been facilitated through the ALERT program as it was employed by the Children's Research Triangle in Chicago. The Seattle group has published information on parent therapy involving behavioral consultation, which has been shown to improve parent effectiveness and to reduce clinically significant behaviors. Alternative therapies have enjoyed some popularity among families. These, of course, are untested and their evidence base is slim, but many families anecdotally report receiving benefit from techniques such as biofeedback, Reiki, and acupuncture. There is no medical treatment for fetal alcohol spectrum disorders. However, many of the component problems can be addressed pharmacologically. Stimulants may help address hyperactivity and inattention, and to some extent impulsivity and other secondary disabilities. Neuroleptic medications can be useful for behavioral regulation and control of aggression, although it must be emphasized that psychosis is not typically associated with FASDs. Antidepressants can be helpful, particularly in older individuals and adults, and anti-anxiety medications also can be helpful, as anxiety underlies many psychiatric and behavioral problems in individuals with FASDs. A number of animal studies have yielded promising results regarding the potential that antioxidants and other agents might be able to ameliorate the effects of prenatal alcohol exposure. EGCG, the antioxidant in green tea, and N-acetylcysteine are two of the agents that have been studied and have shown promising results. Others are reviewed in the paper by Brocardo in Brain Research Reviews and include vitamins, mimics of superoxide dismutase, flavonoids, and other agents, although some of these have yielded mixed results. Choline is an essential nutrient that has previously been shown to be crucial in brain development and also has been shown to mitigate some of the effects of prenatal alcohol exposure when given to rats in the first days after birth, which is equivalent to the third trimester of pregnancy in humans. Initially, this was identified in rat studies in which choline administration to pregnant rats mitigated the effects of prenatal alcohol exposure in their offspring. Human studies in children with FASDs are now underway. Since the initial recognition of fetal alcohol syndrome almost 40 years ago, a great deal has been learned that informs approaches to behavior management, education, and social learning. Ongoing research is likely to result in additional development of medical and dietary approaches that may be able to moderate some of the effects of prenatal alcohol exposure. Despite these advances, prevention is still the only completely reliable and effective means of eliminating the effects of prenatal alcohol exposure. Its successful implementation remains one of the greatest challenges to the FASD community. If you have questions, please feel free to contact us. Outside the region, the best way is through our website.